Hi everyone. Let's talk about the neurovasculature of the pharynx and larynx. So starting out here, we see a posterior view of the posterior wall of the pharynx. So just to orient, superiorly here we have the foramen magnum flanked by the occipital condyles. Here, flanking the lateral aspects are the contents of the carotid sheath, and we can see the superior pharyngeal constrictor, the middle pharyngeal constrictor, and then the inferior pharyngeal constrictor there. Let's erase this so that we can get a better view of what we want to see here. The pharyngeal plexus is a nervous plexus consisting of fibers from the vagus nerve, cranial nerve 10, and the glossopharyngeal nerve, cranial nerve 9. Now both 9 and 10 are coming out of the jugular foramina along with IJ and the accessory nerve, cranial nerve 11. We can't see all the way up to that point here, but they would be in this vicinity, obscured by some tissue. But what we can see that is of very great use to us is a wonderful landmark muscle called the stylopharyngeus. The stylopharyngeus muscle is coming down from the styloid process of the temporal bone and on its way down to insert adjacent to the thyroid cartilage and the wall of the pharynx here. It insinuates itself between the superior and the middle pharyngeal constrictors. So we can see them kind of taking their deep dives right there. So why these muscles are so important, it's not just serving as a landmark to differentiate superior from middle pharyngeal constrictor, but also if you look upon them running on their posterior edge, we are going to see the bulk here of the glossopharyngeal nerve, cranial nerve 9, traversing its way down through the posterior aspect of the pharynx. 9 plays an important role in the pharyngeal plexus in that it is largely sensory or afferent from the pharyngeal plexus. It does have one efferent or motor target, and that would be, yep, you guessed it, stylopharyngeus muscle. So that close association of glossopharyngeal nerve and the stylopharyngeus muscle helps to also explain their anatomical relationship. Now here we're seeing another view of the posterior pharynx. There we can see that the vertebral column has been cut and rotated or reflected out laterally, and we can see the carotid sheaths, or at least their contents, there and there. Now the three major structures that are found in the carotid sheath, and we have some substructures or elaborations of these structures that you're also going to want to know about. But the three biggies throughout that sheath are the common carotid artery, which we can see there. That's a more anteromedial structure. The internal jugular vein, which is a more anterolateral structure. And then the vagus nerve, cranial nerve 10, which is a more intermediate and posterior structure. So common carotid, vagus, IJ, all in a row, which is very nice. We can also see a structure that is very closely associated with the sheath, but what has been pulled away, and that is the cervical sympathetic trunk. Typically this is found just posterior, sometimes a little posterior lateral to the carotid sheath. As we move more superiorly, the proximal portions of the internal and external carotid arteries can be found within the sheath, but we really can't see that here. And also, these have been cleaned away, but any of the deep cervical lymph nodes that would be in association with the internal jugular veins as well as the jugular lymphatic trunks would be found within the carotid sheath as well. This is a more cleaned up version, a better dissected version of the carotid sheath and its structures. So just to kind of point this out, so descending down there, that's your common carotid, there's your vagus nerve, and then there's IJ on its way down. We can also see, and these have sort of been pulled laterally, so the anatomical relationship isn't very well preserved, but we can also see these structures here that I'm highlighting. There's one, and then there's the other. So let me erase them. Maybe I'll circle them so that we can better see what's going on with these structures here. These are the cervical sympathetic trunks, or the portions of the sympathetic trunks that are associated with the neck and up to the base of the skull. So these are the most superior portions of the sympathetic trunk. As you may know, the sympathetic trunk consists of a series of ganglia. In some places they are very regular, such as in the thorax and lumbar region. In other places, such as the cervical region, they're very irregular. So for the cervical region, we have the superior cervical ganglion. And the superior cervical ganglion is typically extending up to the base of the skull, and this is in association with the first and the second cervical vertebrae sometimes, all the way down to the third cervical vertebrae, just so we can orient ourselves. I can see the superior or the greater cornua of the hyoid bone there. That's around C3 level, so we can see that this particular superior cervical ganglion extends quite far down. I can also see here another ganglion. This is the middle cervical ganglion. The middle cervical ganglion is typically associated with about the C5 through C6 level, if it's present. We can see this, I can see a little bit of the thyroid cartilage there. Those might be the superior horns of the thyroid cartilage that would be in line with the greater cornua of the hyoid bone. That's about right. These middle cervical ganglia are typically absent. So if you see them at all, you're lucky. If you don't see them, you can just pass it off as a typical variant. The third and final ganglion, we can see it right there. That's the inferior cervical ganglion. And the inferior cervical ganglion is usually found around C7, sometimes T1 or lower. That inferior cervical ganglion will sometimes combine with the first thoracic ganglion. And when that happens, we usually call it the cervicothoracic ganglion. Cervicothoracic ganglion. And we can see it in the root of the neck, and it can be quite large. Another name for that, because it looks like a star, is the stellate ganglion. And these are usually quite impressive looking. The ones that we can see here would just be inferior cervical ganglia. These do not, to me, look like they would be cervicothoracic ganglia. So moving right along, we're looking at a left lateral view of the anterior neck. And what we want to see here is the vagus nerve traversing down. So this is the parotid gland, which is obscuring sort of our proximal portions of the vasculature in the contents of the carotid sheath. And we can see that IJ here has really been reflected away from the common carotid artery. So we've really exposed the deeper structures, and in particular the vagus nerve, which is right there. Coming off of the vagus nerve quite high, and we can see that right here, is the superior laryngeal nerve. And the superior laryngeal nerve is going to have two terminal branches. There's an external branch, which we can see it branching off quite early. It's usually not this fine, which goes down to be the motor for the cricothyroid muscle. So that external branch is efferent. There's also an internal branch, which we can see coming along there, passing behind the internal and external carotid arteries. And it's sneaking down through this hiatus in the thyrohyoid membrane, along with the superior laryngeal artery, and that's the internal branch of the superior laryngeal nerve. The internal branch is both sensory and secretomotor to the mucosa that are proximal to the vocal folds or above the vocal folds. Here's a nice look at the posterior aspect of the larynx, and this is a highly stylized dissection. So let's orient ourselves to what we're seeing. I can see a little bit of that superior laryngeal nerve coming down here, and I could even see the internal branch of it coming through the thyroid lamina, at least on that side. I don't have a good view of it on the left side. I'm sure that it's there somewhere. More of what I wanted to show you are the recurrent laryngeal nerves. So the vagus nerve is going to traverse down here, and we can see a little bit of that vagus nerve there, and it's disappearing again. And it would continue down, and it's going, to traverse through the superior mediastinum on its way down through the thorax. But on the right side, it's going to wrap around, send a branch wrapping around the right subclavian artery, and that branch is the recurrent laryngeal nerve, and that ascends in the tracheoesophageal groove to innervate the larynx. Now, some sources will give this nerve a different name when it passes the inferior margin of the cricoid artery. Some people will call it the inferior inferior laryngeal nerve. But the inferior laryngeal nerve is the same thing as the recurrent laryngeal nerve. You don't need to make that differentiation. On the left side, so let's see, here comes the vagus nerve, big honkin' vagus, on its way down through the thorax. It's going to send that recurrent laryngeal nerve around the concavity of the aorta before ascending all the way up. So those recurrent laryngeal nerves are quite great travelers, and they are efferent or motor to all of the intrinsic laryngeal muscles. So everything with the exception of the cricothyroid muscle, because that's the external branch of the superior laryngeal nerve. And they are also sensory and secretomotor to the mucosa distal or inferior to the vocal folds. Here we have a nice posterior view of the common carotid artery. So that's what we're seeing there. I can see a little bit of the right lobe of the thyroid gland there. The C-spine has been cut and reflected away. And what's nice about this is we can see the bifurcation of the common carotid into the internal carotid, so that would be the ICA, and the external carotid, or the ECA. Now the external carotid is going to have very many branches that we're going to see throughout the course experience. Probably most important to this particular session is going to be the superior thyroid artery, which we can see is this branch here. It's going down to serve the thyroid gland. And there's a branch of the superior thyroid, which is the superior laryngeal artery. And it's that superior laryngeal artery that accompanies the internal branch of the superior laryngeal nerve through the thyrohyoid membrane. Now, we can also see, and this is a little out of place here, a branch of that external carotid called the ascending pharyngeal artery. That ascending pharyngeal artery is going to serve the pharynx with blood. So this has been tucked away. It's a little out of place, so please excuse that. And we can also see the proximal dilation of the internal carotid there, although sometimes this is of the common carotid, and that's called the carotid sinus. The carotid sinus is a dilation of the carotid arteries in this area, usually of the internal carotid. And contained within those walls are specialized baroreceptors, so pressure receptors, that can communicate back via the autonomic nervous system to let the brain know if it's getting sufficient blood flow or not. We can also sometimes see, and let me kind of erase all of this here, a carotid body. A carotid body typically shows up as a tiny bit of tissue adjacent to the sinus. It's usually darker. In more elderly populations, this carotid body has atrophied. It's gone through a process of fibrosis, so you might not see it at all. The carotid body contains chemoreceptors for reading partial pressures of various gases of the blood as they traverse this area. So it's complementary to the carotid sinus, which contains the baroreceptors. So we have chemo and baroreceptors for monitoring that blood. And then finally, what we're looking at here is a posterior view of, let's see, here we have the pharynx. So that's nice, blending into the esophagus. We've got a right lung there, a left lung there. This is the left subclavian artery, heading out. So here's one of the branches of the first part. That would be the vertebral artery. Here's our thyrocervical trunk. And one of the important branches of the thyrocervical trunk for this particular laboratory session is this one here, the inferior laryngeal artery. I'm sorry, the inferior thyroid artery. That inferior thyroid artery has a couple of branches that we're going to want to know about. There's inferior thyroid artery, and then the continuation of that, the inferior laryngeal. That inferior thyroid supplies the thyroid gland, and it is the dominant blood supply to the parathyroid glands. So we've discussed the various neurovasculature of the pharynx and the larynx. So just sort of to review some of the nervous aspects of this, we've got the glossopharyngeal. So that's 9. Glossopharyngeal will be motor to stylopharyngeus. It's also sensory for the pharyngeal plexus. Then we have the vagus nerve, which is cranial nerve 10. Vagus is going to be the dominant motor to the pharyngeal plexus. The vagus nerve is going to send out the superior laryngeal nerve. That superior laryngeal nerve has an external branch. The external branch is motor to the cricothyroid muscle. And then there is an internal branch. The internal branch is sensory and secretomotor to the mucosa, superior to the vocal folds. And then there is the recurrent laryngeal nerve. The recurrent laryngeal nerve is motor to all of the other intrinsic laryngeal muscles, and sensory from the vocal folds inferior to the mucosa inferior to the vocal folds. And then in terms of blood supply, we can think of it as sort of a 1-2 punch. So we have the common carotid, which has terminal branches of the internal carotid artery and the external carotid artery. That internal carotid artery is largely going to serve the brain. The external carotid artery will serve elements of the neck and face. There will be some orbital arteries that supply the superior portions of the face, like the brow, from the internal carotid, but we'll get to those in a later session. And then we also have, coming from the subclavian artery, we saw the vertebral artery heading up to the brain, but from the thyrocervical trunk, we have the inferior thyroid. The inferior thyroid complements the superior thyroid from the external carotid in serving the thyroid gland. And that also has the inferior laryngeal artery as well. Thank you very much for your time.